Malpractice is apparent in any field, but no profession gets noticed more than doctors, especially as it pertains to overprescribing. Many doctors are the final and last defense in someone's safety, and especially when providing pain management medication. As overdoses and cases of addiction are at a steady incline, surgeons still prescribe way more pills than actually needed. Two main reasons the opioid crisis is in fact a crisis is because of doctors overprescribing and street level trading of drugs. Once a drug is made publicly available, you can count on at-home chemists doing everything they can to try to manipulate and or enhance the effects of a drug. This is detrimental when talking about addiction because it's not just the doctors who become the seller. At this point, anybody can become a seller if you have a pill machine and all the ingredients. I ad-libbed. To effectively talk about overprescribing, we should first know what it is. Overprescribing is when a doctor writes a script, knowing or unknowingly, which provides you with pills, and more often than not, it's way more pills than one person needs. For example, when you get out of surgery, most of the time doctors will give you oxycodone for usually a couple weeks after the surgery. But if he gives you a supply for 2 months, that would be overprescription because no one needs 60 pills for any type of surgery. Following that, we have instead of prescriptions being used as pain management tool, many doctors see it as the end-all be-all for pain management. So instead of different therapies they could go to, physical therapy, any type of therapy, they're relying solely on medication. And what happens with medication is, one, causes addiction in terms of opiates, but medication can also make you immune to that. So as we saw with antibiotics and the overprescription of antibiotics, we see that doctors have no problem in overprescribing, and they have no problem in what happens after you leave the doctor's office. Although overprescription is not the only way addiction starts, it is, however, the most prevalent. When the doctor gives you a script, you often feel safe using what he prescribed to you, considering a professional told you it was okay to do so. In some ways, addicts justify their behavior because they have permission to use these narcotics through doctors and other pharmaceutical companies who would rather make some money right off the top than overall enhance safety of the drug. As stated in the previous slide, overprescription is nothing new. However, the other drugs we saw them overprescribing, such as antibiotics, had no long-term effects, and then had no brain damage, and it had no addictive features. So people kind of overlooked that and never really batted an eye, but it made them immune to penicillin, amoxicillin, all the stuff that helps you fight strep throat, infections, which ultimately those infections, if worse enough, can cause either a great deal of pain, hospitalize you, and or kill you. Once you, it's kind of hard to say, but once you overprescribe one drug, it's not out of the realm of possibility for you to overprescribe on another drug. So there goes the doctor's sense of security and safety as far as being a clinical provider. When we talk about the opioid epidemic, it's important we talk about who started it. Although I wish the answer was simple, there's a couple different factors. One is that big pharma companies and the FDA reassured doctors that the pills are not quite that addictive. In those direct terms, quite addictive, which means so they're addictive, but they just never told them how much. The second is that doctors began overprescribing due to pain management healing. They thought that pain would go away with oxycodone, oxycontins, everything, that we know is bad. There was not enough testing, so they were prescribing it like candy, um, which just put a whole era in addiction treatment. Lastly is the lack of testing prior to the release of pills into the open market. So we were releasing pills that no one actually knew about. We didn't do the right clinical testing. There was no guidelines. The FDA was fairly new and had not been set up completely yet. There was a bunch of different things that affected the way we controlled opiates, as well as you got to realize most of the opiates come from China. They're made in China. Their opium laws in China are very, very loose, especially when it comes to government manufacturing. So it made it easy to get it across into America. One thing that I wanted to touch back on about the purpose and significance of overprescribing is that overprescribing is like anything else. It makes money. And get this, the same company that makes legal fentanyl and heroin for anesthesia is the same company that sells the solution, which is methadone and Suboxone. So the same people that are making your addictive drug are the same ones treating it with a different drug. So, I mean, when you think about it like that, you're giving money to the same people, and they're all crooked. To what works? Improving the way we prescribe opiates is essential towards ending the epidemic. Through clinical practice guidelines, we can ensure the safety of the prescription, as well as make pain treatment way more effective. First, doctors need to determine when to initiate pain management, as well as when to discontinue or stop the prescription. Many doctors like to keep people on prescription because it keeps them coming back, keeps them getting that copay, and keeps them hired. Next, the opioid selection should be correct, and it should be narrow. There should be no wide range of opiates being used. In this case, if some person comes in and you prescribe them oxycodone, they shouldn't come in the next time and be prescribed a different opiate. Assessing the risk of prescribing opiates to a patient can ensure you're not going to make them an addict. So knowing if someone's high risk by what's going on in their life, asking them questionnaires about if they've suffered losses, all these things can not only damage the brain, but it's increased addiction behavior. So when you're at a so-called rock bottom place, it's easier for you to pick up a drug, feel better, and then you become addicted to that drug. You become addicted to that better feeling, and it never goes away. I know addicts today that still suffer with this. What really doesn't work is the continuous denial and lack of acknowledgement of the crisis from doctors and professionals. Not being able to admit when you were wrong only hurts the problem, and it does not find a solution. What allowed for overprescribing was the relaxed guidelines and overview of doctors, with no rules pertaining to prescriptions. In some ways, this is still true today, as we haven't fixed all the parts of our medical system and how we prescribe and how we judge what we should prescribe. For example, we put way too much emphasis on BMI, the body mass index. So sometimes the body mass index doesn't tell how much muscle, how much fat a person has, and if you give too much opiates to a person who's too fat, too muscular, too whatever, it can cause heart disease. It can cause heart attacks. It can cause loss of blood flow, constricted blood flow, all these things that doctors need to take into account that they weren't when the epidemic started. And we know that doesn't work, as we see from the uplifted cases through addiction and through death, honestly. Many people who get addicted do not come out on the other side. I read an article the other day that said 2% of all heroin addicts will remain clean for the rest of their life. As someone who knows addicts, I can tell you, it doesn't feel like 2%. The future for overprescribing doesn't look good right now. Without an increase in education prevalent to overprescribing, nothing will ever change. We need to develop strict guidelines when it comes to prescriptions for opiate use. In order to fix any problem, the first step in finding a solution is to first acknowledge there is a problem, and then quickly identify the severity of that problem and attack it with all you have. Doctors must work on their approach as to when opioids are permitted and when someone is at high risk and should not receive a prescription. In the future, I don't know if this will ever change, especially where we're at now. Most of the damage has been done, especially when you look at addiction. It runs rampant in families. It's not only a persuasive thing, or a peer pressure thing. It's also runs in a family thing. It's a gene thing. Um, Being born with addictive behavior makes you more susceptible, and everything honestly ties into drug use. And if we don't get better knowledge and start treating it as a disease that we could treat, um, overprescription will never go away, because quite frankly, it makes too much money. In conclusion, doctors made the choice willfully to overprescribe even after they knew the risk greatly outweighed the benefit. There's been 3 waves of the opioid epidemic, and somehow we are not any closer to fixing the problem. It seems like we're trying to put a band-aid on a bullet hole. The worst part is there may never be an end to the epidemic. Arguably, the damage has been done because once the drug is on the market, like I said earlier, it is available. It is available for do-it-yourself projects from at-home chemists.